Today, I want to talk about locum practice, private practice in Nigeria as a medical professional. Hello guys and welcome to my YouTube channel. My name is Dr. Peter. Some of my friends and my students call me Dr. Piro. And first off, I'm sorry I've not posted for quite some time. I had to set up a studio and break it down, tear it down and set up another studio, and I'm still in the midst of all that right now. So that's why I've been offline for about 5 weeks or thereabout now. But henceforth, you're going to be seeing more consistent videos on my channel. If you are new to this channel, on this channel I do a little bit of medical lifestyle and a little bit of academics. So if you want to have that smooth transition as a medical student to become, a medical doctor working in Nigeria, then this is the right place for you. So back to local practice in Nigeria, what to expect and how to go about. I'll probably give you like 6 or 7 steps. Now, number 1, you need to get all your documents ready, your certificate, your license, all that's going to be expected of you, your CV, you need to get them all ready. The reason why I'm saying this is so important is because when you are applying for a job, a medical job in Nigeria, one of the first things they're going to ask you is your CV. Your CV needs to look interesting, it needs to look appealing. I've had to go through the CVs of some medical professionals before, and I can tell you on the spot, you can make your judgment based on how the CV is looking. So you might not have an opportunity to express what you can, what you can say or what you can do if your CV is not looking like you. They say on YouTube, we say content is king, but we can only know your content when we get to know you. Appearance on the other side is queen. And how your CV looks is important. It's very important because it's probably going to be the first screening process for you if you're applying for any job. So make your CV look as interesting as possible. You don't have to lie. In fact, do not lie in your CV, but make it look good. If you need the help of a professional, fine and good. Employer wants to be able to build you a CV that looks appealing enough when you're applying for jobs. And I'm saying this because I'll probably do a short video on making your CV look interesting on this channel very soon. So get all your documents ready, your license, your certificates, get all of them ready, because no hospital administration is going to let you walk into their clinic and then accord you all the privileges and graces to a doctor if you cannot prove that you are who you say you are. There are a lot of charlatans out there. You need to stand out of them, and you need some paper, you need some documents to be able to do that. Number 2, be ready for an interview. Likely, if you want to give yourself a job, are you not going to have a discussion with that person? And it's true that not everybody will be able to be eloquent enough to express themselves, and all that, but you need to be able to say what you can do and what you can't do. The reason why this is so important is because if you have to screen 3 candidates, it's the person who is most articulate in what they can do and what they can't do that's probably likely going to get the job. So, and this is probably when you were doing all this presentation back then in medical school. So you'll be able to communicate, you'll be able to say what you can and what you cannot do. And I'm, emphasis on what you cannot do too, because, there's no need to set up yourself for failure when you can't do this major procedure and you say you can't do it. You're just going to be setting yourself, for jeopardy. So be able to communicate appropriately. Get ready for an interview. Number 3, know something about the hospital where you're going to practice in. Are they a maternity center, a pediatric hospital? Do they see general cases or surgical cases? Know about the hospital. What is their remuneration? When is your pay? How much is your pay? And how consistent at a particular date is your pay? So you don't get disgruntled at the end of the day because of the treatment of the hospital. When you know this kind of thing, to be forewarned is to be forearmed. If you're knowing things about the hospital, I can also tell you, know something about the environment, the area you're going to practice in. Let's go back a little to that hospital. Know the working environment where you're going to practice. You might have a high-paying job, but the environment is so toxic, your money is going to be like salty to you. I know a lot of people think, your remuneration, overrides your work conditions, but you will come to see that it's actually untrue. Toxic environments will make that money, to make that, all that pay worthless to you when it's actually a very, negative environment you're working in. So know something about the area you're working into, their social status, is it a rural community, an urban community, so that you can have an idea of what to expect. And not just know about what to expect, but how to talk to the patients and how to, treat them. Can they afford the therapies you're going to be giving them and stuff like that? So know something about the hospital, know something about the area. Mostly old people, is it a residential area, high, workers working somewhere. Know the area you're practicing is going to guide your practice. It's really going to guide your practice. Number 4, know your onions. See, guys, this is why you were cramming all those drug of choice in pharmacology back in the day. What's the drug of choice for this? You need to know your onions. Know how to actually manage patients. If you don't, you're going to keep patients, in a circle of going to various hospitals. You keep them clinic shopping. And that is going to give a bad impression about you as an individual physician, about the hospital you're working in, and about the medical profession at large. Common things occur commonly. There are cases that are going to be beyond you, but there are some simple cases you need to know how to manage so that no case is simple, but there are some cases you need to know how to manage so that you can give patients appropriate care. So you need to know your onions, from fluid and electrobalance to rational antibiotic use. It's very important that you know these things. Talking about knowing your onions, you need to know, okay, where is the local pharmacy in the community? What kind of drugs do they have there? Because if you keep prescribing the first line medication that is in the textbook and we don't have it in the pharmacy, the patient is not going to get it, and then the patient is not going to get well. So what is the second line agent for that particular malady? What are the alternative medications for that particular malady? You need to know these things so that you're able to practice effectively in the community. This is probably most important when you're working in the rural environment. Number 5, and I take particular interest in this because you need to know where you are going to refer the patient to. Peradventure, you cannot handle a particular case in a particular facility. Where are you going to refer the patient to? And maybe more important than where, when. So where is the next tertiary center, or the next secondary center you're going to refer the patient to if you cannot do it alone, or if you need more facilities to be able to treat that patient? This is important because that is someone's only child. That is someone's only surviving parent. That is someone's brother or sister. That is someone's, every life is vital. So you need to know where to refer to, and especially when. And you have to do it promptly too, even if you are doing locum. Know when to refer and know how to refer. And have somewhere that you're going to refer the patient to, so that the patient is going to have, good care at the end of the day and not just go home to die. The last thing I'm going to be talking about is probably I think it's probably my favorite in this, tips I'm giving you here today. You need to know how to counsel the patient. You remember that Harvard model of counseling? Greet, ask, help to recall, tell the patient, explain, recap, and all that. That's a very beautiful theory, but you need to step it down to the language the patient can understand. And you need to make the patient believe you. Else, the patient is going to go back to herbal concoction after you finish managing severe hypertension and the hypertensive encephalopathy the patient came with. It's going to go back to herbal concoction, and it's probably going to, have a lot of morbidity from that. Know how to step down the information to the patient. See, if you do this appropriately, in the first chapter of Hutchinson's, Robert Hutchinson, who is probably one of the most celebrated physicians of all time, he said, no patient should leave your consulting room feeling like all hope is lost. If you counsel appropriately, you are going to save the patient a lot of stress. In the challenges in the healthcare system in Nigeria, healthcare financing is up there, but ignorance is a close second. And counseling can do a lot of damage to that ignorance. You can make the patient, don't let them go back to taking cow dung urine for febrile convulsion. If you counsel them appropriately, they will believe you, and it will change their, medical trajectory for a long time. And that is probably, why you even signed up to be a doctor in the first place. And I think that's why I'm going to draw the curtain in this video. For some of the students that have been reaching out to me about the airside bedside, they talked about what you need to know to go for every word round. The stage is almost set for that series, and you're going to be seeing a lot of content coming out very soon. Also, people talked about the MB series, which I promised some time ago. I think the stage is set for all that, so we're going to be having that very, 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 very soon, and I'm very excited about it. My next video, however, is going to be on telemedicine, and I'm going to tell you about some of the telemedicine platform in Nigeria and how telemedicine is actually from that. Know how to step down the information to the patient. See, if you do this appropriately, in the first chapter of Hutchinson's, Robert Hutchinson, who is probably one of the most celebrated physicians of all time, he said, no patient should leave your consulting room feeling like all hope is lost. If you counsel appropriately, you are going to save the patient a lot of stress. In the challenges in the healthcare system in Nigeria, healthcare financing is up there, but ignorance is a close second. And counseling can do a lot of damage to that ignorance. You can make the patient, don't let them go back to taking cow dung urine for febrile convulsion. If you counsel them appropriately, they will believe you, and it will change their, medical trajectory for a long time. And that is probably, why you even signed up to be a doctor in the first place. And I think that's why I'm going to draw the curtain in this video. For some of the students that have been reaching out to me about the airside bedside, they talked about what you need to know to go for every word round. The stage is almost set for that series, and you're going to be seeing a lot of content coming out very soon. Also, people talked about the MD series, which I promised some time ago. I think the stage is set for all that, so we're going to be having that very soon, and I'm very excited about it. My next video, however, is going to be on telemedicine, and I'm going to be telling you about some of the telemedicine platform in Nigeria and how telemedicine is actually transforming healthcare service delivery in Nigeria. I'm going to tell you about some of the platforms like Ask Dr. D, how you can get on the platform and what to expect, and how to use the platform appropriately. Thank you very much, guys, for watching, and see you in the next video. Cheers.